Initially it was, I was having too many upsetting and depressing moments. I was showing it through aggression and irritability and bottling it. And then through that, I ended up being diagnosed with bipolar 2.
Sadness or depression, worry about practical things like how you're going to get to the hospital, how are you going to pay for your medications, worry about physical suffering, along with anxiety, are all part of the normal reaction to cancer.
Just during treatment, I was so busy with going to the hospital and getting treatment is that I didn't have time to really fall apart. And so it really wasn't until after treatment was over that I kind of felt like I'd been thrown out of an airplane without a parachute. And so it was then really when I felt the severity of a cancer diagnosis. For me, the depression didn't present the same way it had before. When I was depressed before, I was really lethargic and I wasn't motivated to do anything. Like with this, none of that was there. I wanted to be out in the world. I had just survived this thing and I didn't want to waste my time being in bed and being depressed about it. So what happened with me, it was anger. It was just this crazy, uncontrollable anger.
We know from a recent study called the AYA Hope Study that 41% of AYAs report unmet psychosocial needs or the need for counseling support 12 months after their diagnosis with cancer. So after they've been through much of their treatment, after they've adjusted to their diagnosis to some degree, after they've had to make massive changes in their lives to deal with treatment.
So you go and you fill out the DART every time, where you talk about your physical well-being and your, mental and emotional well-being, and then that goes on your profile each time.
Satisfaction with emotional support has been the lowest rated domain in the patient satisfaction with care surveys that Cancer Care Ontario administers every year. We know from lots of research that oncology teams don't recognize emotional distress very well, and often patients don't think of reporting emotional distress to their oncology teams. So more systematically, one of the ways we've tried to help oncology teams address the emotional distress and anxiety in cancer patients is to implement distress screening. We've developed a tool called the Distress Assessment and Response Tool, or DART, that lets patients complete a distress screening survey on computers in the waiting room, and it prints out a report that then we provide training to the oncology staff in terms of how to look at that report and respond to the distress that's identified in the report, and how to provide supportive communication to patients around distress, and when they might want to refer to specialized supportive care.
And I had somebody really close to me who I love, who meant well, say to me, make sure when you fill out the DART assessment that you don't put that you're feeling like really unhappy or really anxious. Like don't put that you're not feeling really well mentally, because then they'll send a whole team of people down. Almost as though this person envisioned, they'll send people down with a straitjacket to sort of take you in. You don't want to be that crazy person. And I just kind of thought, well, but I am that person. I am the person who deals with anxiety. And everybody who's going through treatment for cancer is dealing with some degree of anxiety or depression.
And it's all a question of how severe it is, and does it impair with the functioning of the patient, their ability to get through cancer treatment.
Already I've been, doing therapy for most of my life, and I was just so excited to fill out a form to get myself some therapy. And then it was so weird to have somebody so close to me sort of have this opinion that that's not something that I would want, as though people just sort of tough it out through cancer and then there aren't these sort of residual emotional traumas.